I want to give some information about how to pass exams. So, there are two techniques. If you want to pass your exams, you can use these two techniques. The first technique is read all your textbooks, journals, or all the other documents you have. Read all these textbooks and get the knowledge and sit your exams, and you might get through your exams. But this is a difficult task. Look at the cart. There are so many books. I knew you have this Nelson textbook. There are three parts of Nelson textbook, and there are so other books. You have to go through all these books. It's not easy because there's a big bulk, and you have to go through your journals as well and other related documents. You have to go through all these things. It is time consuming. You need lot of energy. You need lot of time to finish this. So it's a difficult task. If I have to read this Nelson textbook again, I think it's difficult task. But there is another technique. You can use another technique. So that is what I call analyze your exam and prepare for the exam. This is what I did for my postgraduate career. So I was very successful and I got through all my exams in first attempt, DCH, MD and MRCP, all these exams. So I am going to tell you something about these techniques. This is a short story. One of my friend, he was working at a peripheral hospital as a DMO, and he wanted to do postgraduate exams in GNFs. After about 5 years, he had work at this private peripheral hospital. Then he got a transfer to D. Soisa Maternity Hospital in Colombo to do his postgraduate examination. Then he joined with the discussion group. This was a shocking experience for because my friend found found it very difficult because all his friends has done this training for about 2 years. Some of them have done more than 3 years. So they have read all their textbooks. They had this discussion group about 2 years. So their theory knowledge was superb. So my friend didn't do anything during last 5 years. His knowledge is very poor. So still he participated this discussion group about 1 week. After that 1 week, he decided this is really depressing. So he stopped participating in this discussion group and he stopped it. But problem is this, he gave up his DMO post, very profitable job. He gave up and came to Colombo to do this postgraduate examination. He wanted to do this exam somehow. Then he decided, I'll do this exam without participating in this discussion group because it is a distressing event, and he decided to do it alone. So what he did, he analyzed the exam, he prepared for this exam. Then results were out, and you know the results. All his friends got excited when they got the results. My friend got the gold medal, and it was the story. So if you study the exam, if you analyze the exam, you might do well during this exam. So this is what I am going to say. You analyze the exam. What is the meaning of analyze? Read all questions. At least you collect last 10 years questions and read all these questions at least 10 times. Then answer all these questions. If you read all these questions, if you answer all these questions, you get the clear idea about the past questions and what are the things examiners are expecting from you. So collect all your past questions, read at least 10 times and answer all these questions. You can read these answers again and again, and you can get a clear idea about your essay questions. I have done this thing. Still, I have some answers with me because as a memory. The next one is get all the data and other uh, data interpretation questions and the case histories. You have to do at least 3 times these data and case histories. Next one is meet uh, your senior colleagues, those who have got successful during their exams. Ask them what are the cases you got during the exams, what are the questions asked by the examiners, how did you do during these exams, what are the difficult points, what is the reasons to get success during these exams. So get all information about his attempt in the last time. Meet as far as possible senior colleagues and discuss with them. This is what I did with my exams. So I met several candidates. Never forget about the unsuccessful candidates also, because you can ask what is the reasons to failure. Why didn't they do well during their exams? What is the point where did they go wrong? So ask all details about their unsuccessful story. So you can get more lot of information about this exam. And other one is collect details about all long cases. What I did in my during my exams, I collect all the long cases given last few years, and I prepared set of questions and answers as well. So, suppose if you think you might get chronic renal failure with probably waiting for renal transplantation, prepare a set of questions and answers as well. So, like that, you collect set of long cases and prepare questions and answers as well. The next step is collect list of short cases, analyze the pattern. What did they expect during the exams? What are the short cases given in last few years? So this is the analyzing the exam. So if you get all details about your exams, your essay question, your data interpretation, your case histories, long cases, short cases, regarding everything, if you collect details and if you prepare the list and if you go through this thing, you can analyze your exam and get ready for your exams. So these are the basic outline I want to tell you about the exam. So next one is I am going to tell you about some techniques you can use during your studies and your exam. I have used these things and I have told my registrars during their training period, these are the techniques you can use during your training period. First one, how long do you want to read your textbook? Is it 1 hour, 2 hours, 3 hours, 4 hours? No, it is wrong. Have you ever thought why the people in school, in the school period, they divide their their timetable into periods? Why can't they teach chemistry one day, physics next day, biology next day, or maths following day. So why can't they teach throughout the day one subject? Only one teacher has to come to the school, and students need not to carry a lot of books. They can carry one book and they can do the one subject in one day. But that was not the practice. The practice is they don't do one subject at a day. So it is a different kind of techniques. They use periods because we can't concentrate more than 1 hour. That's why they divide into periods. Especially in the school, they confine the periods into 45 minutes. If you read more than 1 hour, your power of memory will be very low. So best technique you can use is confine or limit your reading into 1 hour. Out of this 1 hour, you read only 50 minutes. Keep 10 minutes break. Out of these 10-minute breaks, you can use to have a cup of tea or change your room or prepare for the next day your clothes. You can prepare your clothes for next day or something that do different. Oh, otherwise you can use this to just to summarize what you have read during the last 50 minutes. So don't go beyond 1 hour. If you read more than 1 hour, your memory will not be very good at the end of the day. If you go more than 2 hours, the end of the day, your memory will be somewhere around 25. Look at this graph. If you stop at 2 hours, your memory will be somewhere around 50%. But if you use 1 hour sessions, so memory will be somewhere around 75%. So if you want to remember what you have read throughout the last 1 hour, last day, limit to 1 hour. So you can have 2, 3, or 4 1 hour sessions. So after finishing 1 hour, if you want to go to another 1 hour, change the subject. Don't go ahead with the same subject. That's why school they divide into periods. If you go to the same subject, again your memory will be low. So if you change the subject, suppose if you read something about cardiovascular system, change into a metabolic disorder or nervous system or something different. So don't go more than 1 hour stretch at a stretch. It won't help you at all. So next thing I want to tell you, have you ever heard about this SQ3R method? If you know about this, your um, reading will be more effective and your memory will be more effective than without just reading. So I have seen the candidates, they take the book and start to read A to Z, but that won't help you at all. So this is a very good technique. If you use this technique, this is SQ3R method. So S means surveillance, Q means questions, 3R, that is reading, recall and revision. I'll go one by one. Surveillance. What is the meaning of surveillance? If you want to read some subject, shall we take it as a congenital heart disease? If you take congenital heart disease, don't go and take your uh, big textbook and start to read from A to Z. That won't help you at all. So get few books available with you, turn the congenital heart disease subject and go through the pages. So you might find it very easy in one book. So find that book and then take that book and start to read that book. Before you read, check how many pages you have to read for congenital heart disease. Then look at the diagrams. How many diagrams? How many graphs? Then go through the headings and subheadings. Take a piece of paper, write your headings and subheadings, and just make some note about the graphs and the charts and the diagrams. Then you know you have to read 15 pages. These are the headings, these are the subheadings, these are the diagrams, and these are the charts. But still don't start to read. Get all the past papers and go through these past papers. Check questions about the congenital heart disease. If you go through all the question papers, if you get some questions regarding this congenital heart disease, if you read these questions, you know the examiner's expectation. So when you read, you can concentrate about these special parts, the examiner's expectation. So rather than just reading a textbook, so first of all you do the surveillance, then read all questions. Now you are ready to read. Then you start to read. Remember one thing, while you read, always take notes. I'll discuss how to take notes in a later part, but always remember to take notes. Otherwise, you can't go through these books again and again because these are so big books and don't have time to go through again and again. So get notes and you can go through the notes again. So prepare notes. Next one is recall. When you have a free time, just recall what I have read about the congenital heart disease. What are the congenital heart disease? What are the topics? What are the important things I want to remember? What are the questions asked by the examiner? So what are the things I need to go through? So this is a recalling. So recall everything about the subject. Next one is revision. Revision means you have to go through the notes again and again, at least several times to remember these subjects. So this is a very important theory, SQ3R method. I have used this thing. It is very effective. If you use this thing when you read your textbooks, no point of reading A to Z because ultimately your memory will be very poor at the end of the day. If you use these techniques, your memory will be very good and you can remember or recall or about everything what you have read. So I am going to tell you, once you read, how to remember all these things. I use 5 techniques to improve your memory. One is repeated revision. You need to revise every subject 5 times. Just think about tetanus vaccine. You know, once the baby is born, he had to get 5 tetanus vaccine. Why do they offer 5 vaccines instead of 1? They can give 1 vaccine, but the power of memory about regarding the immunity is very low. If you repeat this tetanus vaccine at 2 months, at 4 months, 6 months, and 1.5 years and 5 years, so you get the 5 vaccines, and the power of memory regarding the immunity is very high. So this memory remain in the body for years and years. Same thing applies to your revision. You need to revise your subject at least 5 times. So this is the accepted theory. You read your subject and revise the same thing again and repeat this revision next day. No need to go to the textbook. You go through your notes, the notes you took yesterday, and repeat the revision 1 week later, and again 1 month later, and 6 months later. If you do these 5 revisions your memory will be very good and you can remember everything what you have read during these subjects. Next one is mind mapping system. I'm not going to talk about this thing. I want to just tell about the mind mapping. If you want to go through this subject, go to the book written by the Tony Buzan. He was the person who invented this mind mapping system. If you go through his book, this is available at bookshops. You can read this mind mapping system. This is you can use to improve your memory. Third one is mnemonics. I think you know about mnemonics. The very famous one is LR6 SOPO thrice. LR6 means lateral rectus nerve is supplied by the sixth nerve, SOPO superior oblique by the fourth nerve, and the rest of the eye muscles supplied by the third nerve. So there are so many mnemonics. You can prepare your own mnemonics and you can use it to improve your memory. The next one is I have used this thing, fixed diagrams and pictures on wall. If you find difficult subjects, prepare a note as a diagram or picture and fix on the wall. When you have a free time, suppose before you go to the hospital or before you go to sleep, just go and stand in front of your diagram and go through the diagram or picture. Turn other way and get a piece of paper and write that diagram on the piece of paper. If you can draw this diagram on your paper, you can remember. That's mean you can remember your subject. Whenever you have free time, do it again and again. If you can change these pictures and diagrams time to time, depend on your requirement. So, but this is a good exercise. Don't waste your time. Just spend 1 or 2 minutes. That is enough. Other one is get assistance of others. It may be your friend or your wife or your husband or family member. You write some questions and hand over to them, and time to time ask them to question you about this what you have written on the paper. So they need not to have a medical knowledge. If they can read English, that is enough. So you write the questions and hand over to them and let them to question you. So you have to answer this. So these are the few techniques you can use to improve your memory. So with this, you can improve your memory. So this is one technique you can always use to improve your memory. So next one, have you heard about 80 by 20 theory? This is a good theory. I have used during my training period. Meaning of this is if you read 100% of your textbook material, that means you can't read 100% of your textbook material. At least you can go through 80% of your material. If you read this thing, suppose your big textbooks, Nelson textbook, you can't go through 100%. But if you read 80% of these textbooks, you can remember 20% out of what you have read these textbooks. But you know, this is a very difficult task. It consuming lot of time, need lot of energy, and it's not easy. So you have some other jobs to do. You have to look after your family. You have to look after your social life, and so many things you have to do. If you don't go spend so much of time on this subject, ultimately you will end up with 20% of memory. But there is another technique you can use. This is select most important subjects from your textbooks. Take a highlighter pen and mark most important 20% out of these textbooks. So if you so you will ask from me, how do you select this 20%? Go through the past papers, go to the past essay questions and data and all cases given last few years. So get the information about that and select most important 20% out of your textbook and mark with the highlighter pen. So go through these most important subjects and revise it five times, and you can have memory about 80% of memory which is required to pass your exams. The rest of the 20% you can collect by participating your lectures, your word class, and your discussion group. So you can collect rest of the 20% by doing these things. So this is very easy. You read only 20% rather than going through 80% of your big textbooks. So I have used this technique and it is so easy to pass your these postgraduate exams. So try it and see during this period. I think it is very useful. Right, I'll go to the next one. Notes. Always you have to take notes. Otherwise, you can't remember everything what you have read through these big textbooks. There are two types of notes. One is linear notes, other one is the pattern notes. I think you are familiar with the linear notes because this is the traditional methods we have used. It goes for few pages, sometimes maybe 5, 6 pages. Problem is it is difficult to remember. But pattern notes are different. It is more flexible and it is you can use it remember the subject easily. It confines to one page, only A4 size paper. You have to take this landscape format, and during this format, you can add details into this one. I'll show how to do it. So this is easy technique rather than going through the linear notes. So this is the linear notes. You go I think you are familiar with these linear notes. It's not confined to the one page. It goes to the 1, 2, 3 or few pages. But this is difficult to remember. The pattern notes is different. This is the one of the pattern note prepared by my registrar. So have a close look. She was prepared this regarding anemia. This is confined to one page. This is the landscape format. Look at the short form she has used. HX means history. There are few important points to ask regarding the history. And then examination. She has mentioned what are the things look at the skin, face, eye, mouth, and so on, I think. So next one is causes. So when you see a microcytic anemia, macrocytic anemia, normocytic anemia, she has mentioned about all the causes. And next one is investigation. Again, depend on the MCV, depend on the size of the red cell, she has decided to go different type of investigation. And management is depend on the cause. She hasn't put that thing here because it is depend on the cause. So look at this format. Everything on one paper, one side of a paper, A4 size paper. So if you go to these pattern notes, you can remember the subject very well. So if you get a case with anemia, these are the things you need to ask, these are the things you need to examine and possible causes and investigation. If you put it in a linear notes, it's not easy to remember like this. The next pattern notes is prepared by me. Just see, I have prepared regarding the hematuria and proteinuria. Look at the first one, history. There are few specific questions. Then other causes of red color urine. I have mentioned about hemoglobinuria, myoglobinuria, drugs, and Then diagnosis. How to diagnose hematuria? In uncentrifuged sample, more than 5 red cells in 1 milliliter is diagnostic of hematuria. In sediment sample, in high power field, there should be more than 5 to 10 red cells. So, likewise, proteinuria depend on the protein creatinine ratio. Then investigation, first line and second line. So, how to differentiate upper GUT and the low GUT. So, how to differentiate these two? So, this is the pattern notes. If you go through these pattern notes, you can remember these subjects very well. Otherwise, it is not easy. So, go through these pattern notes and prepare these pattern notes. It will be very helpful to remember your subjects. I'll go to the next one. So, answering questions. I have seen registrars. They think they know about the answer, no need to write the answer. No, it's not like that. If you want to perform well in your exams, you have to go through all these questions and answer all these questions. It gives you a good experience. Even if you know the answer, you need to write it on a piece of paper. So get all the questions last 10 years, get CR book and write answers for all these questions. It's the experience, how to change the paragraph and what are the important things to include in these answers. So you need to go through all these questions and answer all these things. The next one I want to say, do not start writing answers immediately. Leave few minutes. At least read questions twice. You know, we have discussed these things with the examination department of Sri Lanka. So they started this technique now. Earlier days, they distribute question paper and the answer paper same time. Now, from last year, they have decided to distribute the question paper 15 minutes before their scheduled time. So a student, the A-level students have got this 15 minutes to go through the question paper rather than straight away starting writing it. Because I have seen some occasions during the postgraduate examination, especially that they have understand the question completely wrong way and they have given the wrong answers. So one of my friend, he lost his gold medal because of this problem. We were expecting gold medal from him, but he lost it because he misread. So at least go through the question twice and leave few minutes to analyze the question. And before you write the answer, if you can prepare some pattern notes like this, suppose your question is regarding neonatal jaundice. So you can prepare some format like this. So neonatal jaundice, what are the important things you want to write it during the exams? One is causes. Next one is investigation. Third one is management. Fourth one is prognosis or follow-up. So if you divide this your subject into categories like that, when you write it, you can divide into paragraph and you can complete all these subjects. If you start without making some plan like this, you might not do well during your writing. So always go through or prepare some pattern notes like this before you write it. Otherwise, always you are going to miss some topics, because I have seen some answers when they ask question like this, they are sometimes they go through the courses for rather than going through all this investigation, management and follow-up. So they write one section lot, but it's probably other section very few. So not to miss this, prepare a plan like this and start write like this. then you can do very well during your exams. So next one is mock exams. I think this is the most important thing you have to know during your exams, because this is the place where most of the candidates do very poorly during their postgraduate examinations. Shall I put it in this way? This year, they are going to do final exams. They divide into two parts. So one is they are going to ask questions about the clinical exam as last few years. It's a long case and short cases. And 50% mark was allocated for these subjects. And next 50% is allocated to different subjects, something like this. It is, we'll say, it's a marathon, not marathon, 100-meter race. So this year, suppose you are going two parts of your final exam. One is as routing exams, long case and short case, and USA questions. And the 50% is going through with the 100-meter race. So we'll take up this 100-meter race. So if you go through this 100-meter, if you read all the details about the 100-meter, you take the textbook and you read textbook about the 100-meter, how many centimeters to the 100-meter race, how many inches, how many feet for this thing, and you read all the textbooks, then you go to the internet or wherever, and you read about Susantika, how did she manage this 100 meters. So you read about Usain Bolt, how did he do during this 100 meters. If you read all these things, rather than going to field and going to practice this 100 meters, if you go through the theory about the 100 meters, you might not do well during your exams. So if you want to run 100 meters, you have to run. You can't just read theory and get everything about the theory. It's not helpful. Same principle applies to this long and short cases. If you want to do well with these long cases and short cases, you have to do it. If you do 5 times, or if you do 10 times, or if you do 50 times, or 100 times, those who have done more and more, they do better during their exams because they get the experience. It is the experience. You can't run the 100 meters on this competition day. So need to get training. At least you have to run 100 times to get the training on these subjects. Same thing applies to your exams cases. For long cases and short cases, you have to do 100 times or more than that. So before the exams, you arrange these things with your friends. Select the topics. Topics means you select the cases and arrange the exams with your friends. So one candidate, one registrar can be a candidate, and other two registrars can act as examiners. So as in the normal exam situation, get the history and present to the examiners, and examiners can ask questions about the subjects, candidate can answer. So this is a practice test. So if you want, you can video it and replay and assess it. So then you can assess your quality of your presentation. Remember always, time management is very important. I think during our training period, I have done this several times. Still, I feel it was not enough, because when you are going to do the real examination day, you feel this. If you do these things again and again, you get the training and you can do it easily. So this is very important. So rather than just sitting and reading your textbooks, use this opportunity, mock exams. So get your friends, arrange it with your friends, and do it with your friends, and easily you can go through these long and short cases. Remember time management again, very important. So you can adjust with your mock exams. Next one is, I want to tell something about this because during the last few years I have seen this problem, vocabulary and voice. You remember most of the examiners are old and their hearing capacity may be low, and so if you don't talk very well and they can't get to what you want to say. So clear voice, rich vocabulary, proper grammar and good tone makes the difference. If you can talk very well, so examiner will get your answers very well. So it finally affects your marks. So because it's very important. So get some training on these subjects. The best thing I always ask the registrars to do the presentation, record it, and keep the recorder 2 meters away from you, and switch on and listen to it. And if you clearly hear your voice, if you can understand what you want to say, if your grammar is good, vocabulary is good, you can do very much better during your exams. So this I have seen in some countries, some places they have this training on this subject also. So you can get this training while you are getting trained in your postgraduate in your hospitals with your friends. So it's very important. So make some arrangement for this thing also. Next one, I want to say something about the exams. What is the meaning of exams? The examiners select candidates who are going to be work with them as their colleagues. If you are not suitable to be colleagues with your examiners, they don't like to take you as a consultant, because consultant should have some level of management skills and confidence and everything what the examiner is expecting from you. So your confidence during these exams is not only your knowledge, you have to show your confidence. So show your confidence, whether you are suitable to be a colleague of the examiner. If they feel, if they feel you are good, so you can show your confidence. Eye contact is very important, and sit steadily during your exams and maintain your eye contact. It shows your confidence, and you can stay on your conversation rather than letting you to ask the examiner to answer the questions. So you steer your conversation. So you can go on rather than waiting to examiners to ask the questions. What is the meaning of this thing? What I want to say, suppose you are going to discuss about the congenital heart disease with heart failure. Same time you are saying, my patient has a problem with the social, my patient has some problem with his social life. So examiner might tend to ask some questions about his social life. But what you want to say is, in during that time, you say, my patient has some social problems. I am going to discuss these social problems the later part of my discussion. So then examiner might not ask this question. So you can carry on your conversation without difficulties. Otherwise, examiner might stop you and you might ask from you about these social problems. So you decide how to continue this examination conversation. So again, what I want to say is time management is very important. I have seen last years some students didn't score very well because of the problem with the time management. They have so many details to express during their exams, but they don't have enough time because they haven't managed their time very well. So these are the things I want to tell. I have not gone through everything, but I want to show you some important things what you want to go through during this studies and examination. So use some of these techniques I have given you this